In Sickness and in Wealth, Documentary Analysis. The documentary In Sickness and in Wealth, 2008, from the cycle Unnatural Causes discusses the connection between wealth and health. The authors explain that when people have sufficient resources, namely, money and power, they are able to sustain their health well. People who experience financial struggles and face many stressors, such as low-paying jobs, bad living conditions, environmental dangers, and other worries, suffer from significant deterioration of their health. The film addresses the social problem of inequality in healthcare, how wealthy and powerful people have access to quality care while financially challenged populations do not. Inequality has many facets, and the accessibility of medical care is one of the most important and acute ones. The Whitehall studies show that British civil servants who belonged to higher social class had less risk of dying from various diseases than those who came from the lower class. The conclusion of the studies was that good health is directly related to higher social and economic status. The wealth-health gradient shows the correlation between high income and social status and health. People who are able to afford a good education and later secure a high salary live longer than those who do not have these opportunities. The bar graph shows how access to good healthcare, food, entertainment, and, generally, a good life declines from the wealthiest to the poorest in a constant slope. These four people are examples of key social and economic classes through which one can observe the correlation between income/power and health. Jim Taylor is the healthiest of the respondents, and he is also the wealthiest and the most powerful one, being the CEO of a big company. The interviewee's health declines along the line, with Mary Turner at the bottom, who has the poorest health condition of all and also happens to be an unemployed mother. The documentary shows how the degree of power and the level of income influence one's life by using these four people as examples. The data comparison shows that different areas of the city house very different classes of people whose life experiences vary tremendously. Lower classes experience significant stress due to underpaid jobs, lack of affordable healthcare, worries about their children's future, and unsuitable living conditions, which contribute to their poor health. Meanwhile, higher social classes live in perceived safety, which facilitates a much less stressful life and helps maintain stable health. Income inequality, gender pay gaps, and discrimination are the primary reasons for these differences. People who lack education or are graduates of less prestigious colleges, those who come from poorer backgrounds, women, and racial and sexual minorities often experience discrimination, especially in the working field. When a person is in control of their destiny, they have significantly more freedom in what they want and are able to do. For example, a person who has a stable passive income does not have to worry about the consequences of losing their job, and those who have a car do not have to spend a lot of time on public transit. The feeling of safety that comes with a high-paying job, good support group, and other resources reduces stress, which in turn positively affects their health. While in the past 60 years, the United States policy regarding healthcare has improved significantly, there are still many inequalities that need to be addressed. Moreover, the constant battle between Democrats and Republicans has also negatively affected these policies. The overturn of Roe v. Wade is a prime example of that. The current policies do not provide enough social security for vulnerable populations such as ethnic or sexual minorities. Future policies should address the most acute issues that affect American society. Those are equal and more affordable access to food, healthcare, and college education, better housing opportunities for financially challenged populations, elimination of gender and racial pay gap, and provision of stronger civil rights.